Hello, Nicolas. Nice to see you. Thank you so much for joining me.
Hello, how are you? Is
I'm
everything
good.
okay?
Yes, everything is good. Thank you so much. So, Nicolas, can you introduce yourself so that we know a little bit about your background?
Of course, I'm Nicolas. I'm an MD pharmacist, founder and CEO of NP Labs, which is in the National Compounding Pharmacy based in Athens, Greece from 2006. We mainly produce bioidentical hormones for both men and women, sterile injectable products like IVs and, of course, peptides and other injectable products, plus customized supplements, cosmetics, products for pets, and more. Um,
Well,
okay, and we mainly send our products to more than 50 countries around the world, clinics and doctors from all European Union countries to Middle East, Africa, USA, South America, Asia, you name it.
okay. Well, that's great. Wow, what an experience. So it's almost 20 years of experience in bioidentical hormone field, kind of, right? That's great. Yes. So, Nicholas, the reason why I wanted us really to have this call, as you know, I want to show our patients the difference between bioidentical hormones, the difference, and synthetic hormones, the difference in their absorption, in their assimilation, in the structure, and how actually they may affect our bodies differently. Especially we are talking about female body, but we also, of course, we cater for male as well, but mainly female body. What is the difference from your perspective between bioidentical and synthetic hormones as a pharmacist, as an MD, as a person that been running the pharmacy for over 20 years now?
Well, bioidentical hormones are compounds that have the exact same molecular structure as the hormones that our body produces. Because the structure is identical, the body recognizes them and interacts with them the same way it would be with the endogenous hormones. So with these all hormones like estradiol, progesterone, testosterone, DHA, pregnenolone, so they have more physiologic action, lower risk, and better profile via the synthetic analogs. They improve tolerability. Patients report better mood stability, better sleep, better libido, better skin quality, and better metabolic effects. Bioidentical hormones have flexible dosing and delivery via the synthetic hormones that you can buy from the pharmacy.
Yes. So, okay, let's go step by step. So, bioidentical hormones, once they get into our bodies, because, am I understanding it correctly? Because it's the same hormone molecular structure as our bodies, they do not suppress our own hormone production. Is that so?
Yes, they do not suppress. They just come and fill our production. So if we have, lower levels of a hormone, when we get bioidentical hormones, they come and we optimize the levels. When we get synthetic hormones, they suppress the production, our own production. Like for instance, with testosterone, when they get testosterone injection, then you do not produce any more testosterone.
Yes. What about absorption of those hormones? Because, of course, side effects, potential side effects are very important for our ladies to know. What about absorption? The minute your body is not absorbing it well, of course, we will have one organ or the other will feel that effect. So what about the absorption of bioidentical versus synthetic?
Of course, they have a better absorption because since we produce them in the lab, we can change a lot of things in the absorption. For instance, we can use for a bioidentical hormone as the progesterone or estradiol cream, we can use liposomal cream or another, like an HRT cream, something like that. So it depends on the patient, and we can change, we can change the way that a patient will affect with the cream, so will absorb better cream. Same way, we can add to a capsule some ingredients that will do, the absorption of the ingredients of the hormones in the capsule a lot better. On the other hand, when you get a synthetic hormone from a pharmacy, it's just this. It's just a pill or a capsule. That's it.
Yes.
Much more better absorption with the bioidentical hormones comparing to the synthetic ones.
And what about the side effects? Let's take, for example, some of our main ones, estrogen and progesterone. If we take, let's say, bioidentical, do we face any side effects at all?
On the other hand, I will tell you that we face a lot less effect comparing to the synthetic one. For instance, with estrogens, you know that the big concern with the estrogens is the breast cancer risk, okay?
Yes.
Having said that, for the last 20 years, we have thousands of patients that they have taken bioidentical hormone from our lab, okay? And we have never seen not even one case of a breast cancer.
So
not
it's
even one
basically
case.
Taken out
Yes.
of nowhere, the statement, right?
Yes, of course. We have more than 20, 30,000 women that have taken bioidentical hormone from our lab, and we haven't seen not even one breast cancer. Because I like to say bioidentical hormones are the results of the cooperation between the doctor, the patient, and the lab, the pharmacy. Because we produce what the patient needs, okay, to optimize the hormonal level with estrogens, okay? And the doctor asks for the patient to have every 3 to 6 months blood tests. We always see what are the levels of the hormones. And if, for example, we monitor them. And if, for example, a doctor see that a woman has, increased levels of estradiol, okay, they might increase the progesterone, for instance. They might increase the progesterone, or they might give some other products such as DIM, an estrogen protection.
And that's very true. And our center, as you probably know, we are also a functional medicine and regenerative medicine. So we do implement a lot of supplements, science-driven supplements that help hormone therapy. So that's a very good point. Another interesting point that I've kind of encountered as of lately, the binding of those hormones. So each hormone will go in our body and bind to a receptor of that particular hormone, right? So tell us, please, the bioidentical hormones, when they're in the body and they bind to hormone receptors, how is the process versus synthetic hormones when they are binding to receptors? Because this is a very important also point for our ladies to know.
Since these hormones are, equals a lot like the same with our indigenous hormones, we face a lot less problems. The binding is stronger, okay? So as long as we give bioidentical hormones, we have a better binding, a stronger binding. That's why the receptors of the hormones work a lot better.
But then bioidentical hormones don't overstimulate those receptors, right?
Yes, they don't overstimulate. They stimulate the exact amount that we need.
And versus
we keep these receptors, open and working.
Interesting. And what happens with regarding synthetic hormones?
Generally, the synthetic hormones overstimulate the receptors. They give so the body takes the message that we don't need to produce any more hormones because the receptors are full. That's why the body stops producing any more hormones.
Yes, that's a very, very important point for our ladies to know. So let's talk a little bit about progesterone, natural micronized bioidentical progesterone versus progestin, synthetic progestins. What are the main differences between them?
The bioidentical progesterone has, of course, superior safety profile. As I said before, it has lower breast cancer risk and minimal thrombotic risks, okay, versus the synthetic one. It has better cardiometabolic effects on lipids, blood pressure, glucose, vascular tone. And of course, it has superior sleep and mood benefits.
Yes, absolutely.
It increases GABAergic activity. So it has a lot of better sleep, relaxation, reduced anxiety. Has more effectiveness in the endometriosis and the endometrial protection, and it has no androgenic side effects. So it has not acne, no hair loss, not mood instability, and of course it has better tolerability.
What would you say about using, because ladies are asking us, why wouldn't I use the progesterone as a cream? what is the actual, from your point of view, what is the actual chemical kind of absorption and whether it actually works for us?
Especially when we're talking about liposomal creams, you have a very good absorption of progesterone. So you increase the level of progesterone that you want to do that without, having the first liver effect in your body. So progesterone does not go, through the liver and goes directly from the cream that absorbs directly to the blood circulation.
But at the same time, I've seen that our progesterone creams somehow do not absorb and do not increase the blood works of progesterone. And that's why we give the tablets, not the tablets, but the capsules.
The capsules, yeah. Well, this is the magic of compounding, because we have, let's say, we produce progesterone capsules, progesterone cream, and and of course we produce progesterone sublingual troches or lozenges. When the doctor see the blood test of the patient, the doctor can choose whatever is better for the patient. Because if the patients absorb well the tablets, the capsules, they can stay with the capsule because it has a very good sleep results. Right? If the patient does not absorb the capsules, can go with the cream. If the patient cannot absorb the cream, can go with a sublingual form. So you have many weapons if you want to increase the progesterone levels without having the side effects of the synthetic one.
Yes.
It's just not one product. There are many different products we use.
And synthetic, you don't have a variety, right? Could you talk a little bit about the synthetic one? Synthetic
one, you just let's say you just have one capsule. No, I don't want to name some drugs that are in the market, but you have one capsule. That's it.
Yes, so you cannot adjust the dose. You cannot adjust.
You cannot get it sublingually. You cannot get it. It's just one capsule you can have.
Okay, very interesting. What about bioidentical estrogens? Well, estradiol, estriol, and synthetic estrogen. What is the main difference between them?
Because they have more physiological action, okay? Estradiol and estriol and estrone. They have lower thrombotic and cardiovascular risk, especially the transdermal one, okay, which are very well absorbed. And they have, as I said before, they have a very lower cancer risk comparing to the synthetic one. They have better metabolic profile. They increase the insulin sensitivity. They have a better lipid profile, very bone metabolism. On the other hand, the synthetic ones often worsen the triglycerides, the insulin resistance, and the blood pressure. Generally, they have a superior safety profile.
Bioidentical hormones. So what are the synthetic estrogens in the market? What are the names of them, of those drugs?
Well, there are many of them. They have synthetic estrogens in tablets. They have in patches, like the tablets have something like Cyclacur, patches have something like Dermastril. They have Blessel creams, and they have many different in many different countries. Okay, and that's another problem actually, because you can find, let's say, a patch with estradiol like Dermastril in one country, and you cannot find the same patch in another country.
Yeah,
that's true. You can find in a region and not in another region.
Yes.
On the other hand, you can find from a compounding pharmacy the same products worldwide.
Yes,
absolutely. And you can give this product to your patients, wherever your patients are, in Europe or in Middle East or in Asia or in USA.
Yes, absolutely. So it's a stable supply of bioidentical hormones rather than we actually have exactly the same scenario. A lot of women, for example, families are moving to Dubai and they're asking us for patches, they're asking us for pellets, but we do not have it here. We do not produce them here. They're actually in Dubai. Whereas ladies are telling me, well, in America we used to get it, but well, we are not in America, so it's a very different story. Whereas bioidentical creams, capsules are available at any point, whenever you are. Yes, very.
Exactly. Now you that you mentioned the pellets, okay, which is an amazing form of estrogens and progesterone, things like that. So you can use from a compounding pharmacy a cream or capsules in the beginning, and then a woman can go into the pellets, okay, and only have a pellet. That's only, as you know better than me, it's only a 5-minute procedure in your office, and for 6 months it's done. The levels of the estrogens are high, the levels of progesterone are high, and everything is optimized. So it's a win-win. I don't see any side effects here. I don't see any problem with the woman. She's very happy. It's affordable. You cannot have this with the synthetic hormones. We want to optimize the levels of the hormones, and on the same time we're gonna have safe hormones without any problems, and especially the cancer rate.
Absolutely.
These two things we have it only with the bioidentical hormones.
Yes, absolutely. So what would you suggest, for example, if a lady had cancer, breast cancer, but there are different types of cancers, but we are talking specifically breast or ovarian
Breast
cancer.
cancer.
But 2 years ago, we have quite a few cases like that, 2-3 years ago. Would you recommend her bioidentical hormones?
Yes, but these ladies should have blood tests every 3 months.
Yes. Absolutely.
Okay, and check the blood levels, check their estrogen levels, and as I said before, you have many weapons, so you have to give an estrogen protection that comes with supplements like DIN, also sulforaphane, or may increase the progesterone levels that act like an antagonist to estrogens. So a woman, in my opinion, should take hormones even though she has breast cancer a couple of years ago.
And when there is a cancer in the family, she should take it even more so, right? Because it's not in her body, it's a family, and genetics doesn't often pass it to the person that is being treated, right?
Exactly. But always, under the supervision of the doctor.
Absolutely.
Very often, blood tests, because we need to have, a full idea of what's going on with the hormones.
Well, at Medi-Gyn, as you know, that we offer our support on a regular basis for any lady. A lot of the
Yes.
time, I end up on the call or on WhatsApp with them, just explaining tiny bits how to take, what to take, when to take, and also post treatment care. So our ladies are actually quite happy and quite safe. But I think it's because we provide that support, because we provide that follow-up, because we provide that post-treatment care. And it's very important. And then, of course, how important is the renewal consultation with the doctor?
It's very important. Actually, this is the real work, because what we don't want is a patient to take a hormone and then come to you after 1 or 2 years.
Yeah.
Okay. So what we want is the renewal consultation every 1, 2, 3 months to come back to you or have an online consultation and and measure their hormones, see the results, see if they have any side effects, see if they feel good.
Yes.
Okay. So it's a whole holistic procedure. It's not just a gynecologist and a woman. It's a whole holistic procedure.
Yes, absolutely. And this holistic procedure is really kind of at the heart of Medi-Gyn work, because we do believe that unless you treat the whole body, treating one organ, one hormone, or 2 hormones, it's not going to give that positive effect.
Exactly. The hormone level might be okay, but the woman might have fatigue or might, have low libido or low, low energy.
Yes.
So you have to fix this.
One of the last questions I want to ask: what do you think about providing a lady with the whole therapy consisting of all hormones rather than just estrogen or progesterone, or estrogen and progesterone? A lot of the times I hear that doctors prescribe only estrogen without progesterone, which is of course not what we do. But we also offer the whole array of hormones, the whole family, as I call them, of hormones: progesterone, estrogen, pregnenolone, DHEA, and of course testosterone. So what is your view on that?
I believe that the woman should take, as I said before, the whole hormones. Should take, and ideally, plan should be like an estrogen cream with, let's say, 2 estrogen BS or just estradiol, progesterone capsules or cream, of course, DHEA, which is a pre-hormone,
Yeah,
DHEA,
because
of course, pregnenolone and testosterone. And testosterone have great results in the libido, especially if you use it, as a vaginal cream with a little of estriol or just plain testosterone, has great libido effects. And this among with other supplements that the woman needs. So it's not only one hormone.
Yes, absolutely.
As I say, it's not only about it's not about lifespan, it's about health span. So yes, we live longer, and yes, we need to take a lot of supplements and hormones if we want to optimize our life.
Yes, absolutely. To be active and to be independent, really,
Yeah,
all
active and
our
independent, as you say, of course.
Okay, great. Nice. Very nice talking to you, Nicolas. Thank you so much for your time, and thank you so much for this clarification. I'm sure it's our first
Anytime.
call, but hopefully not the last one.
No. We can talk anytime because I think that we have a lot of usual thing for your patients to say.
That's great. Thank you so much, Nicolas. Thank you. And thank you for your time.
Thank you very much.
Okay.
Take care. Bye-bye.
Bye. Bye.